There's concern our children are missing out on being immunised for diseases like whooping cough and measles. That's because the COVID pandemic has impacted parents bringing their children to the GP, resulting in lower vaccination rates. For more on this, Royal New Zealand College of GPs Medical Director Dr. Brian Betty joins us this morning. Dr. Betty, can I first start with reports of a mystery strain of a deadly hepatitis that has now been reported in 12 countries worldwide? Any information about the risk here?
Yeah, look, this has emerged over the last few weeks. There's been about 170 cases in children, especially in Europe, some in the US and Israel. We don't know what's caused it. Hepatitis is an inflammation of the liver, often caused by a virus, but it's not testing positive to the normal things that give us hepatitis. That's hepatitis A, B and C that we see in New Zealand. So there's a bit of uncertainty about why this is happening, why these children have got it, and there's been one death reported at this point.
Okay, hepatitis is of course included in the immunisations that our young people get, but looking at those numbers, under 2-year-olds, the number of immunisations has dropped from 90 to 82% in the last year. For Māori, it's even lower, down to 68%. Are these numbers cause for concern?
Oh, these numbers are of huge concern. In particular, we're really worried about measles. Because we've got a combination of events occurring here. We've got these dropping immunisation rates, and Māori in particular, as you mentioned, are down to 68% fully immunised at 2 years. Now, what we know about measles is it is brought in from overseas. So with the borders opening, we may see measles in New Zealand at a time when we've got these lower immunisation rates and this lack of protection for our young children in tamariki, and in combination with rolling into winter, where people tend to congregate indoors, so it could be very transmissible. Now, measles is a dangerous illness, as we saw before COVID when we had the South Auckland outbreak.
Yeah, I mean, in 2019 it was declared an epidemic, 1,500 cases then and a third hospitalised. How quickly could we get back to those kinds of numbers?
Well, look, we don't know at this point. However, this combination of factors, this lower immunisation rate in particular and the borders opening, make huge cause for concern. And we need to remember measles is dangerous. We saw in Samoa, when measles got into Samoa, that there were 80 deaths amongst children. And at that point, Samoa had an immunisation rate of about 70%. So we're actually getting very close to that level, and we are not protected at that level. We should be sitting around 90 to 95%. So this is a real concern.
RSV, of course, a cold-like illness, I guess, is also one of the illnesses that is expected to hit us this winter. What is riskier for kids, RSV or COVID?
Look, I mean, they're both diseases we want to avoid. We do have an immunisation for COVID, which is really important. We don't have immunisation for RSV. RSV is around every winter, we know that. What has happened before last year, for the previous 2 years, we had very few cases in New Zealand. What we're potentially going to see this year is a very mixed picture with RSV, these winter illnesses, plus COVID and the flu. So it'll be a very complex picture this year with a lot of viral illness around, which could be very problematic as we move through winter.
Yeah, so the government takes its, I guess, cues from COVID deaths that are reported each day, but given the fact that we're now still seeing COVID deaths reported as people who die with COVID and because of COVID, and we don't know the breakdown between them, when we're going to have an increase in winter illnesses, how are we going to know whether those deaths are as a result of COVID or winter illnesses?
Look, this is going to be very complex and very difficult, because you're absolutely right. The numbers that are reported may not be purely a COVID death. They can be due to some other cause, but you happen to test positive for COVID. So that is really complicating. One of the things that will probably start to happen is swabs to see if people have COVID, if they have influenza, or the potential for a combination of COVID and influenza. So there'll be a lot of uncertainty, I think, about the numbers as we move into winter and what that looks like, and whether it is COVID related or one of these other winter illnesses. And we need to remember that every winter, traditionally in New Zealand, 500 people die from the flu. So that's not COVID related, it's flu related. So this is a very, very mixed picture we're moving into at this point.
But those numbers could be reflected in the COVID deaths that we see reported. Do you think there needs to be more testing or a different kind of breakdown so that we actually have a more accurate picture of what is an illness that we have dealt with for decades through our health system and what is an illness that is directly related to COVID and needs to inform our health planning?
I think there's a lot of work going on in this space to try and work out exactly how to break down the figures and give a more accurate picture of what's actually happening as we do move into the winter months. There's a lot of work going on. What does COVID surveillance look like over winter? What does flu surveillance look like over winter? What does surveillance for these things like RSV look like, to try and separate them out? This isn't an easy task, I'd have to say that, but we do need to work on this. We do need to try and separate the results out so we know that what is directly COVID related versus one of these other winter illnesses. And I think this is critical for planning going forward, not just for this year, but for future years when we know that we will have a COVID very mixed viral illness picture.
Yeah, it's the only way we'll know whether we've actually got a handle on the epidemic or not, is surely.